We're all going to die one day, and we all know that, but death isn't something we like to talk about. And often when we do, it's out of necessity. Because many of us think we're going to die peacefully in our sleep, but that's not the reality for most Canadians. With cancer and heart disease being the leading causes of death, there's really little comfort or control at end of life. That's why medical assistance in dying, or euthanasia, or MAID as I will call it, was decriminalized in 2016 to help suffering patients regain some of that control over their bodies and their lives. Since then, the service has been the subject of extensive debates and court cases about how this new practice should be governed or expanded in the future. However, no one's really stopping to assess how this new service is working or not working for those who are directly engaged with it now. So in my research, I set out to interview and examine the experiences of MAID providers and families of patients who access MAID. In Manitoba, unlike any other province, we have a unique single entry system into MAID, where a centralized team of physicians, nurses, and social workers respond to all requests province-wide and make sure that not only the patient is taken care of, but also their family members, who can sometimes be sidelined in the process. The good news is our team has been held up as the gold standard across Canada and has been commended by all of my participants. However, other themes I discovered in interviews show that issues of accessibility exist and largely link back to the lack of public and professional education on MAID. As the quotes at the top indicate, many patients are surprised to find out MAID is allowed in Canada because it's not included into end-of-life conversations with their doctors and nurse practitioners. Even more concerning is the widespread misinformation among these healthcare providers who don't understand or don't know eligibility requirements, which ultimately trickles down to patients and delays or even prevents access for them. The last major concern is that religious hospitals like St. Boniface and half of the nursing homes in the city don't allow MAID on their premises and force dying patients to endure cruel transfers in order to access a legal service. As you can imagine, and the quotes on the bottom indicate, these transfers are a drain on resources. They're difficult for staff and families alike, but most of all, they cause complications for patients who are seeking a peaceful and dignified death to begin with. And sometimes they prevent MAID from being an option at all. MAID services have come a long way since 2016, and changes are being legislated now. But there are still barriers to access for eligible Canadians that need government attention. So the purpose of my research is to highlight these aspects because we are all going to die one day. And I hope that when the time comes, we can all make our own end-of-life choices in the most comfortable, accessible, and informed way possible. Thank you.